I wanted to give you a little bit of background on Advize Health. At Advize Health, we analyze processes, create protocols, and implement solutions for healthcare entities of all sizes. Advize Health has been in existence for over 12 years and employs the industry's top experts. We offer many services, including healthcare compliance analysis, medical documentation auditing services, and educational opportunities for a number of topics, including ICD-10 training and clinical documentation improvement. Our priority and promise to the healthcare industry is to always tailor our services to our clients' individual needs and provide cost-efficient services that every entity is able to afford. We have two exceptional speakers for today's presentation, Maria Candia and Deanna Anderson. Maria is a medical audit and quality assurance specialist with Advize Health. She has more than 20 years of coding experience and currently audits medical records for multiple providers from various specialties in both the private and government sectors. Ms. Candia oversees the accuracy of multiple auditors to ensure the accuracy, consistency, and adherence to CMS, CPT, and NCCI guidelines. Her auditing skills and expertise have assisted many clients in detecting abusive, fraudulent billing and coding practices. Ms. Anderson is a coder, auditor, and provider educator for Advize Health. She has over 10 years of experience in coding and auditing. Ms. Anderson is required to code to the highest level of evaluation and management, as well as code the ICD-10 codes to the highest level of specificity and apply modifiers when applicable. Ms. Anderson also engages in provider education to ensure compliance is met and maintained. Ms. Anderson has been a certified professional coder since 2008 with the AAPC. Her other certifications include CPMA and Certified Evaluation Management Coder with the AAPC. Today, they will be focusing on chiropractic services. Please keep in mind that today's presentation is for educational purposes only and does not constitute as legal advice. Also remember that if you have any questions throughout the webinar, be sure to submit them via the questions or chat box in the GoToWebinar interface and send them to all organizers. I'll make sure that Maria and Deanna have time at the end to answer them. You can expect to receive an email with your certificate for 1.5 CEUs, a copy of the presentation, a recording, and a transcription of the Q&A session 3 to 5 business days after the webinar. I'll now turn it over to Maria, who will begin the presentation.
Thank you, Maggie. Good afternoon, everyone, and thank you for joining our webinar. The topics of discussion are chiropractic principles overview, what are the billing and from an auditor's perspective, why is it so important to check NCCI edits for chiropractic service, when is it appropriate to bill CMT with manual therapy. We'll also be discussing the claims processing in accordance with Medicare Claims Processing Manual. We'll also be looking at time-based codes, and we'll have a question and answer session. Chiropractic principles focus on restoring joint position to influence neurologic function on the premise that normal neurologic function will allow the body to effectively heal itself. Some core principles: that structure and function exist in intimate relation with one another. Structural distortion can cause functional abnormalities. The chiropractic adjustment is a specific, definitive method for the correction of the vertebral subluxation, and that the subluxation influences bodily function primarily through neurological means. Doctors of chiropractic have a deep respect for the human body's ability to heal itself without the use of surgery or medication. Here are some documentation trends that we have identified in the course of performing record reviews for chiropractic services. Handwriting that is difficult to read, Incorrect CMT codes billed for the number of regions documented and supported in the record is manipulated. Billing for manual therapy when provided at the same site CMT was performed. Use of non-standard abbreviations. EHR templates that include the treatment as a future plan, but the documentation is not clear as to what was actually performed. EHR templates that list the CPT code and descriptor without any documentation of the procedures being performed. Exercise modalities with no notation of what type of exercise was performed. Misunderstanding of the appropriate application of modifier 25. Appending 59 modifiers to procedure codes when there is no NCCI edit with the other billed codes. Billing for modalities without documenting the anatomical site of application. Adding addendums that were either not dated or made greater than 30 days from record or chart completion. And time-based codes with no time documented. This illegible documentation example from the assessment and plan portion of the note shows just how difficult it is to determine the level of medical decision making, or even be able to tell if the service supports medical necessity. As you can see, it's nearly impossible to identify the provider of service based on the signatures shown in the example. And additionally, they do not meet CMS's signature requirements. We have found that providers bill for the incorrect number of regions manipulated. In this particular example, 5 spinal regions were billed for when only 4 were supported: cervical, thoracic, lumbar, and sacroiliac region. We have also found that they use some non-standard abbreviations that are not common to the specialty, or they don't provide a key defining the abbreviations used within their practice. So when auditing these notes, it can sometimes be very difficult to determine and to decipher what the abbreviations stand for. In this example, you can see that manipulation was performed on the cervical and thoracic region, and that the manual therapy was also performed on these sites. Now, there is an NCCI edit and does allow a modifier. However, it is not appropriate to report code 97140 manual therapy and a CMT code when describing services provided to the same region. Both codes should only be billed if the manual therapy is performed at a separate region. And here you can see the edit showing that there is no CCI. I'm sorry, you can see the edit here allowing the modifier. EHR templates that include the treatment as a future plan, but documentation is not clear as to what was actually performed at the time of the encounter to support the billed services. And here you can see the plan of treatment. The patient will be seen 1 time per week for a period of 3 weeks. The patient's treatment program will include a diversified adjustive technique at T5, 6, T6, 7, or 9, 8, 9, 4, 0. Therapy will include electrical stimulation for 12 minutes on the thoracic region to reduce muscle spasm. and the patient has been instructed to use a moist, hot compress while at home. Now, this provider, with this documentation, billed for the CPT codes in the example. And that is all the documentation to support the procedure at the current encounter. We found EHR templates that just list the CPT code in a descriptor without any documentation of the procedures being performed. And here you can see where they have listed the visit and the procedure codes, but within the body of the note, there was no procedure note. This is the only documentation of the procedures being performed, just the CPT codes with a brief descriptor. And this is very common. We have found this to be very common in chiropractic documentation and billing. Time-based codes with no time noted. And in this example, it's CPT 97035, ultrasound each 15 minutes. And the provider has documented ultrasound was applied today to the lumbar to reduce the inflammation associated with this injury. And again, you can see that there is no notation of time. Exercise modalities. Exercise modalities with no notation of what type of exercise was performed. And here you can see therapeutic exercises, and the provider has circled the lumbar for a period of up to 10 minutes, but there is no indication of what type of exercise was performed. And appending 59 modifiers to procedure codes when there is no NCCI edit with the other billed codes. And here you can see the 3 procedure codes. Modifier 59 is appended to all 3 codes. And below, when you check for the NCCI edits, you can see that there is no CCI relationship found. So this is an overutilization of modifier 59 and a misapplication of it. We've found that they bill for modalities without documenting the anatomical site of application for the modality. And here we have traction, and the provider just documented it with an X in the box with no indication of where the traction was performed, at what site. According to CMS's 2015 CERT report, the improper payment rate for chiropractic services is calculated at 51.7%, with the most problematic area being insufficient documentation, attributing to 95.8% of the errors. Claims are placed into this category when the medical documentation submitted is inadequate to support payment for the services billed. In other words, the CERT contractor reviewers could not conclude that the billed services were actually provided, or were provided at the level billed, and or were even medically necessary. Claims are also placed into this category when a specific documentation element that is required as a condition of payment is missing, such as a physician's signature on an order or a form that is required to be completed in its entirety. The OIG has included chiropractic services in their fiscal year 2016 work plan. They will review Medicare Part B payments for chiropractic services to determine whether such payments were claimed in accordance with Medicare requirements. Prior OIG work identified inappropriate payments for chiropractic services furnished during calendar year 2006. Subsequent OIG work for calendar year 2013 also identified unallowable Medicare payments for chiropractic services. Part B pays only for a chiropractor's manual manipulation of the spine to correct a subluxation if there is a neuromusculoskeletal condition for which such manipulation is appropriate treatment. And chiropractic maintenance therapy is not considered to be medically reasonable or necessary and is therefore not payable. Medicare will not pay for items or services that are not reasonable and necessary. Some red flags to carriers: routinely billing for an E&M code for every patient encounter, routine use of full spine x-rays, billing for all new patients with a high-level E&M code, high incidence of modifier 25 and 59 utilization, and also high incidence of billing CMT with manual therapy. The difference between modalities and procedures as defined in the Physical Medicine and Rehabilitation section of the CPT manual. Modalities are any physical agent applied to produce therapeutic changes to biologic tissue. Includes but not limited to thermal, acoustic, light, mechanical, or electrical energy. Modalities may be classified either as supervised or constant attendance. Supervised modality does not require direct one-on-one patient contact by the provider and describes codes 97010 to 97028. Constant attendance modality requires direct one-on-one patient contact by the provider and describes codes 97032 to 97039. What is constant attendance or contact? Constant attendance involves visual, verbal, and/or manual contact with the patient during provision of the service. For constant attendance modalities, there is a need to stay with the patient in order to safely deliver the therapy service. At this time, I am now going to turn it over to Deanna Anderson.
Hi, thank you, Maria. We're going to continue on with manual therapy. Per CPT, therapeutic procedures are defined as a manner of effecting change through the application of clinical skills and/or services that attempt to improve function. Physician or other qualified healthcare professional, such as this therapist, required to have direct one-on-one patient contact. This is for our code range 97110 through 97546. This is a time-based code that requires constant attendance. This code also includes all pre, intra, and post services. Code 970 represents manual therapy techniques. This is also a time-based code. Therefore, it is billable with 15-minute increments, and time must be documented in order to support this code. It is not appropriate to report code 97140 and a CMT code when describing services provided to the same region. When a CMT code and manual therapy are performed in a separate region, it is appropriate to bill for both codes. CMT is a form of manual treatment to influence joint and neurophysiological function. The treatment may be accomplished using a variety of techniques. There are over 100 types of adjustment techniques used, but generally chiropractors will focus on and utilize about 8 to 10 different approaches in their practices. Our CMT code range is 98940 through 98943. The overpayment rate is greater than 50%. This percentage consists of claims billed with CMTs 98941, which is the 3 to 4 spinal regions, according to the 2015 CERT. Understanding the spinal manipulation. The common goal of most chiropractic technique is to restore or to enhance joint function with the general goals of resolving joint inflammation and reducing pain. Some approaches use force, which is spinal manipulation, while others use a more gentle approach, which is spinal mobilization. Chiropractors adapt treatment plans to meet the specific needs of each patient. Treatment plans may involve both spinal manipulation and mobilization during the same visit over the course of treatment. And typically a patient will be seen between 6 to 10 visits. The spinal manipulation. The most frequently used chiropractic technique is the spinal manipulation, and this is the traditional high-velocity, low-amplitude thrust. The manipulation often results in an audible pop as chiropractors use their hands to apply a controlled sudden force to a joint while the body is positioned in a specific way. Spinal mobilization. Some conditions such as osteoporosis, pathology, the patient's size, patient comfort, or patient's preference may require a more gentle approach, generally referred to as spinal mobilization. In addition, some patients and or clinicians prefer mild spinal mobilization techniques that do not involve twisting of the body or a forceful thrust. Our CMT codes, which is our code range 98940 through 98943, includes the pre-manipulation patient assessment, a review of the radiographs, interpretation of the test, treatment planning, pre-manipulation procedures, manipulation, chart documentation, and counseling. Therefore, billing a separate E&M for the above services would not be justified and should not be billed with modifier 25. When multiple levels of treatment within one region occur, it should be billed only as one region using 98940. For instance, if treatment were to involve the L3, L4, and L5, since they are all within the lumbar region, it would be inappropriate to bill 98941, which covers 3 to 4 spinal regions. CMT documentation must indicate the specific segments or areas that have been manipulated. There are 2 ways in which the level of subluxation may be specified. The exact bones may be listed, for example, C4, C5, C6, etc. Or The area may be reported if it implies only to certain bones, such as the Atlanto-Occipital, the lumbosacral, or the sacroiliac. The Medicare Claims Processing Manual states that the chiropractor must have the initial date of treatment or the date of exacerbation of existing condition. This must be kept and maintained on file. Specifications of the precise spinal area or areas. X-rays are no longer a requirement, but may be used to demonstrate subluxation, which would in turn support the medical necessity of the spinal manipulation treatments. This slide indicates adjustment and denial codes that providers may receive, such as the patient's condition is not reasonably related to subluxation, not deemed medically necessary, or the claim lacks the required information, such as the initial date may be missing. This slide demonstrates the 5 regions that are supported by 3 CPT codes. We have our 98940 through our 98942. And then we went ahead and we did our breakdown of the cervical region, which is the Atlanto-Occipital Joint, and C1 through C7, our thoracic region, which is our T1 through T12, including the posterior ribs, the lumbar region, L1 through L5, the sacral region, and then our pelvic region. And then we went ahead and gave a spinal anatomy just to give a further breakdown of the 5 regions to where you can see where everything is actually located. Our extraspinal manipulations. The extraspinal is 1 or more regions when we're billing for this code. This is on top of doing the other regions that we just spoke about on the other slides. This code covers the head area. It covers the lower extremities, the upper extremities, and the rib cage. Now, for the rib cage, this would take care of the anterior rib cage, as the posterior rib cage is covered under the other CMT codes. And then this also takes care of the abdomen. The Atlanto-Occipital Joint, didn't know if I was unaware of this joint when I was doing research, but this is the joint that is located at the base of the skull, and when we nod our head back and forth for saying yes, we can feel right where the joint is located. And without this strongly bonded joint, our heads would fall off of our necks if we ever experienced some major trauma. So it holds our head on top of our shoulders. When billing 98940 through 98942, which represents the spinal regions, it is not appropriate to use modifier 51 if the extra spinal regions were also manipulated during the same session. For example, if your spinal region is taken care of, and then the provider also manipulates the arms or the legs. The modifier is not required because these codes represent anatomical locations. Our 8-minute rule per CMS. The time intervals for billing the CMT codes, there's an 8-minute rule that's in play, and again, this is per CMS. In order to bill 1 unit, time must be documented 8 minutes through 22 minutes, 2 units, 23 through 37 minutes, and so on and so forth. And this pattern remains the same for treatment times in excess of 2 hours. Okay. It is not appropriate to count all minutes of treatment in a day toward the units for one code if other services were performed for more than 15 minutes. When more than one service is represented by a 15-minute timed code, the total number of minutes of service determines the number of timed units billed, as shown on the previous slide, slide 45. And here we have some examples on billing or counting our times. This patient had 2 treatments or services done with the total treatment time of being 47 minutes. The 47 minutes falls within the range for 3 units, 38 minutes to 52 minutes. So the appropriate billing for 47 minutes is 3 timed units. Even though we're only seeing that 2 tests are done, we can bill for 3 units. Each of the codes is performed for more than 15 minutes, so each code shall be billed for at least 1 unit. The correct coding is 2 units of our 97112 and 1 unit of 97110, assigning more timed units to the service that took the most time. In this example, we have 2 treatments, each at 20 minutes, giving us a total treatment time of 40 minutes. The appropriate billing for 40 minutes is 3 units. Each service was done at least 15 minutes and should be billed for at least 1 unit, but the total allows 3 units. Since the time service is the same, choose the code for 2 units and bill the other for 1 unit. But you would not bill 3 units for one specific code. If you have a situation like this, this is where you would look at I would bill the one with the higher total RVUs, which would be code 97112. So I bill 2 units for that and then 1 unit for the 97110. In this example, we have, again, 2 treatments that were done, again, totaling 40 minutes. The appropriate billing for 40 minutes is the 3 units. So with this, we would bill 2 units of our 97110 and 1 unit of the manual therapy, the 97140. So we would count the first 30 minutes of the 97110 for 2 full units. We can then apply the remaining 3 minutes to the manual therapy code 97140 in order to justify billing for that code, because we have 2 codes and we have to take the total timed treatment. In this example, we have 4 procedures or 4 treatments that have taken place. Appropriate billing is only 3 units. We would bill the procedures you spent the most time. So in this case, we would bill 1 unit for each the therapeutic exercise, the manual therapy, and the gait training. Unfortunately, we are unable to bill for the ultrasound. This comes back to we have to refer to our timed table. Even though there were 4 services that were done, the total time is equal to 49 minutes, which only allows the 3 units to be billed. If, for instance, the total time was 53 minutes, then we would be allowed to bill for all 4 codes. Okay. When 2 timed services are documented at 7 minutes or less, the total treatment time consists of 14 minutes. With that being said, you may only bill one of the procedures performed as 1 unit. Keep in mind the threshold for 1 unit is 8 through 22 minutes. And again, I would bill the CPT code with the higher total RVUs. And this is an example of what that slide was indicating. We have 3 services. Each Each of the services was spent at 7 minutes. Total treatment time was 21 minutes. We can only bill one unit for for an example like this. So here we would pick our code that has the higher RVUs, but all the others must still be documented that what procedures took place. Even though we cannot bill for them, they still have to be documented appropriately. Per CMS, each service does not need to have individual times documented as shown in the examples provided, but it would demonstrate that the provider is using his or her best practices when documenting, and this would also support total treatment time when you're coding and if you're ever audited. These next 7 slides that we have available for you are the terms commonly used by the chiropractors, and it just a lot of terms that some folks may be unfamiliar with, but we put this in here for you to review on your own time if you'd like.
Thank you, Deanna and Maria, for that informative presentation. We are now going to go over a few questions, so if you haven't sent any questions in, you can send them to all organizers at this time. Let me take a look. We have one question here that is referencing the times again. It says, if my provider performs 4 services and time does not meet 53 minutes, does he lose out on billing one of those services?
Unfortunately, yes. I'm going to go back to the slide. And if you can bear with me here. And again, this is our timetable. So when there are more than one, if there's more than one service being performed, we have to go by total treatment time. So if your provider is billing or has 4 treatments that were done, and the total time still falls within the 3 units, 38 minutes through 52 minutes, then yes, I would recommend not billing for the lowest service with the lower RVUs.
Thank you, Deanna. We have another one that is asking what documentation should be included in the assessment and plan for chiropractic services.
The documentation in the assessment and plan should include, of course, the diagnosis, any long and short-term goals with expected functional outcomes. It should include a brief post-assessment of the treatment rendered and the patient's response to it. Patient instructions such as home care, apply ice, heat, exercises to be performed, or any nutritional recommendations by the provider should be noted in the assessment and plan. The plan of treatment, how often the patient will be seen and what type therapies will be performed, any changes to the treatment planned, and any complications from any treatment performed at the time of the encounter. Those are all items and elements that should be included within the assessment and plan.
Can time be documented on the flow sheet, or does it need to be in the visit notes?
It should be. It can be documented on both on the flow sheet and in the note. That would be the best practice.
I agree.
Thank you. How do you determine the highest total of RVU codes?
If you have access to an Encoder Pro or one of the applications that are out there, when you put your codes in, it will tell you what the RVUs are. If not, you can go to your CMS, your local MAC region. You can put your codes in and you can find out your RVUs in there as well.
Excellent. Thank you so much. That actually appears to be all the questions we have for today. If anybody has any additional questions that you think of after the fact, Maria and Deanna both have their email addresses at the end of this presentation that you may send a question or two their way. And I would just like to thank you all for attending today's Advize Health webinar on chiropractic services. You can expect to receive your CEU certificate and webinar handouts, including the presentation slides and a transcription of the Q&A session in the next 3 to 5 business days. That concludes our webinar for today, so thank you everyone. Have a great